If you go to a doctor who dismisses it, please ask about sleep apnea testing and get tested, even if you don't snore. You don't need to be snoring to be diagnosed with sleep apnea. I'll say it again. You don't have to snore to be diagnosed with sleep apnea. And you don't have to be obese to be diagnosed with sleep apnea. Hi, so today I'm going to be discussing menopause and insomnia and how those two things are connected. If we haven't met, my name is Dr. Odoy. I'm the founder of Oasis Women's Functional Medicine, where I help women with fatigue, especially during perimenopause and menopause. And today I'm going to do a deep dive into how menopause affects our sleep. I've done the first video where I went through the structure of sleep or the architecture of sleep. And one important aspect of sleep is the deep sleep period, where it is not REM sleep, but it's deep sleep. And we see that as we get older, the amount of time we spend during deep sleep or the depth of deep sleep reduces. So one thing is that as we go into menopause, we get older, and so we have less amount of sleep during deep sleep. I'm sure you have noticed that babies can sleep through anything because they go very deep during deep sleep and they spend a long time during deep sleep. Whereas women, by the time you have your first baby, we are spending less time in deep sleep. And so that's one big thing that we find happens during menopause and perimenopause is the amount of deep sleep becomes less. And one important thing that happens during deep sleep is that we get to clear toxins from the brain. And so this is when our glymphatic system, which is the lymphatic system in our brain structure, clears out toxins. So imagine when you are spending less time in deep sleep, there is less clearance of these toxins. And so that's where we start to see things like brain fog. Well, there are other causes of brain fog, but that's one cause, especially if you are not spending a long time in sleep. So then there is that connection of the glymphatic system clearance and brain fog when you are in perimenopause. Did you see what I did there? So that's, usually that cloggy thinking that we tend to see during perimenopause and menopause. So you might be asking, why do we see that happening? The number one thing that I have seen in my clinic is that when women go into menopause, their risk of sleep apnea begins to go up, and it actually surpasses men. Okay, so during premenopause, when we have estrogen and progesterone, you don't see a lot of sleep apnea in women. But as soon as women hit menopause, especially around age 60, we see an uptick of sleep apnea. And sleep apnea, it's a sleep disordered syndrome, and basically it affects the quality of sleep. And so if you are having trouble sleeping and you are in menopause, I will encourage you to talk to your doctor and make sure you get tested for sleep apnea, because we see a big rise in that. And there are hormonal changes that contribute to that development of sleep apnea when you are in menopause. The first thing is that we have estrogen receptors in our muscles everywhere. And you do have muscles up here in your throat area or your oropharynx. And that's the area involved with sleep apnea. So whenever you have any sort of obstruction in your airway, you can see that the people with that obstruction have sleep apnea. Basically, it's obstructive sleep apnea. And with menopause, we see a decline in estrogen. And with a decline in estrogen, we see less muscle tone in that area. We also see a fat redistribution in our airway, which then causes the obstruction because you now have more fatty tissue that is blocking the airway, and that puts women at risk for sleep apnea. And so that's why it's so important that when you are having issues sleeping, please don't just say, well, this is part of menopause and I have to live with it. You don't have to live with sleep apnea. There are so many treatments out there that you can explore so that you can sleep better. Because remember, if you don't sleep well, remember the lymphatic system and the clearance of toxins in your brain when you are sleeping. And so if you are not sleeping well, those toxins are not being cleared. And so then you are likely to suffer from brain fog. And it's not just the brain fog that affects your day-to-day life, but also we see a high risk of development of dementia when you are not sleeping well. Again, it links to lack of clearance of toxins in your brain because you are not sleeping well. So if you are not sleeping well in menopause, please do not dismiss it. If you go to a doctor who dismisses it, please ask about sleep apnea testing and get tested. Even if you don't snore, you don't need to be snoring to be diagnosed with sleep apnea. I'll say it again. You don't have to snore to be diagnosed with sleep apnea. And you don't have to be obese to be diagnosed with sleep apnea. I have seen women within normal weights who have sleep apnea, and we did not know they had sleep apnea until they were tested. So long story short, if you are in menopause and you are having trouble sleeping, please make sure that you've been ruled out for sleep apnea. In my clinic, most women get tested for sleep apnea because it's so dangerous. Sleep apnea can increase cortisol, right? It can also disrupt your sleep and lead to instances of dementia. It can also cause, we see a correlation between stroke, heart disease, high blood pressure, and sleep apnea. So it is not something to write off. It is not something to dismiss, especially in menopause. Hormone replacement therapy helps, of course, but if you have sleep apnea, that needs to be treated as well. I hope this was helpful. And so if it was helpful, please forward it to another woman who is in menopause and is having trouble sleeping. Please get tested for sleep apnea. So important. And if you have any questions, again, I invite you to leave it in the comments below. I read them, any comments that come every day, and I'm happy to respond. Thank you again for watching, and I will see you next week.